and today I want to share with you my experiences as a public ally for the UPMC's program, the Birth Circle Doula program. The Birth Circle Doula program is unique. It's one of only a few handful of community-based doula programs in the U.S. The Birth Circle Doula program provides doulas to underserved women in the Pittsburgh area. And a lot of you probably do not know what a doula is. A doula is a woman trained to provide one-on-one emotional, physical, and informational support during pregnancy, during labor and delivery, and during the postpartum period after birth. Most doulas are hired by women who know what a doula is and can afford to pay for one. That's usually like several $100s in Pittsburgh. The Birth Circle Doula program is different. We serve a population that would qualify for medical assistance. Most of our mothers don't know what a doula is, and we serve a very diverse group of women from diverse cultural, racial, and socioeconomic backgrounds, and we work a lot with the refugee populations here in Pittsburgh. Community-based doula programs are important. They've been shown to improve outcomes for mothers and infants. They increase breastfeeding rates, they decrease interventions and cesarean section rates. They create more positive birth experiences, they increase parent-child interaction, and improve parenting skills. And the doulas that are trained as community-based doulas are women that are drawn from the communities they serve. And they're trained to offer peer-to-peer support. But really, to get at the heart of what a community-based doula does, I really want to share with you some of my stories from the women I've served this year. As a community doula for the Birth Circle this year, I have attended over 30 births. I have worked with women from India, China, Nepal, Bhutan, Tanzania, Kazakhstan, Uzbekistan, Burma, Somalia, and Mexico. I've worked with young teen mothers, and I've worked with mothers having their first child or having one of many children. I've worked with women struggling with addiction or recovering from addiction. I've worked with women who have had completely natural births attended by midwives and women who've had really high-risk pregnancies with lots of interventions. I've also had the opportunity to work with many doctors, nurses, midwives, community organizations, and social workers. So as you can see, the work of doula, community-based doula is very broad, and to really do the work, I have to really adapt my care to the woman that I'm serving. To really give you a picture of that, I want to share a few what we call birth stories. There's one woman I served this year, and I actually missed her delivery. I didn't meet her beforehand. This is a birth where I was called in. And she delivered so quickly that I actually missed her delivery, but I showed up right after the baby was born. And it turns out she didn't have any support system there for her. So I sat with her for hours after her birth. And then she was a recovering addict. So her baby needed to be kept in the hospital several days beyond her own stay in the hospital. And she would sleep in a chair in the hospital to be with her baby and to try to maintain a breastfeeding relationship. And she would go to the drugstore to buy like frozen meals to feed herself. Like this is after she just had a baby. And I was one of the few people that actually showed up for her several days in a row just to provide support to her. And she said to me, she looked at me in the eyes and said, you know, Ahimsa, you're the only person here that's not judging me right now, that's just providing me with support. For another woman that I served, she was having probably like her 5th child. So she had birth several times, but one of her previous births was a cesarean section. And she had actually had a home birth in there too, and she really, really wanted a natural delivery in the hospital. And she was very nervous that she wasn't going to be able to have that. And I really worked with her, mostly with education, and I have worked with a lot of the hospitals and care providers in Pittsburgh. So I told her how to talk to her care provider to get the kind of birth she wants. And she had one of the most amazing births that I've seen in a hospital environment. She spent probably like 7 to 8 hours in the shower birthing the way she wanted. And that's hard for women who are considered women who've had a cesarean section are considered high risk, so they don't usually have that freedom to move around as much in labor. So her care providers were able to navigate that for her based on the information I provided. And she said to me that just knowing that I was present there with her throughout her labor provided her that reassurance and that confidence to speak up for herself and say what she wanted. Another birth I want to share was a birth I did for a refugee. Her and I actually became really, really close, and I still visit her today. Her baby's about 6 months old, and I still stop in and visit her whenever I'm near her home. She was having her first child, but she was very, very, very nervous about having a baby in a U.S. hospital because of some circumstances. A baby from their community actually died. It wasn't the hospital's fault, but that's what happened, and she was nervous about that. So I was able to provide prenatal care and one-on-one prenatal education geared to what was important to her. So because of that, she was able to go on to have a really nice delivery in the hospital, and she told me that she felt really secure knowing that I was there for her and with the information I had provided her. I could go on telling birth stories for a long time. They're all really moving. There's some that are really kind of traumatic and intense, and there's some that are really beautiful and moving and celebratory. But I'd like to end this with an invitation for you to just find out more about maternity care in the U.S. It's an important topic, and a lot of people don't realize it. Out of all the developed countries in the U.S. often ranks the lowest. And that's despite the amount of money that we spend on prenatal care for women. The C-section rate in the U.S. is 33%. The World Health Organization recommends that a C-section rate should be around 10 to 15% to have the best outcomes for women. If the rate is above that, we're actually doing more harm than good. And then there are actually a lot of disparities in the U.S. healthcare system for expecting mothers, especially for women of color or like these refugee populations that we serve. And I get to witness this a lot firsthand to see how women are treated differently, either based on their race or them not speaking English. So it's always hard to see that firsthand. Community-based doula programs are just one step in the direction of improving outcomes for mothers and infants in our country.